further impacts of COVID-19 on other medical issues and vice versa, and that includes our mental health. Joining us now is Dr. Melanie Schwartz. She is a clinical psychologist and the owner of Viewpoint Psychology and Wellness. Dr. Schwartz, thanks for being with us again.
Thank you.
Appreciate having you on. So there's been some recent developments. The CDC recently added mental health disorders to the list of underlying medical conditions that could have an impact on people's bout with COVID-19 should they become infected. What went in, to your knowledge, what went into that, or at least better yet, to your knowledge and your expertise, how can mental health disorders, mental health issues play a role in how someone may be afflicted with COVID-19?
Well, mental health and physical health are intertwined completely. So if you're not mentally healthy, and that looks different for different people, it's going to impact your physical health. Number one, probably because if your mental health is not where it needs to be, you're not taking care of yourself. Okay, so you're not exercising, you're not eating healthy, you're struggling with sleep, not taking medication, vitamins, the list goes on, then your body's not going to be physically where it needs to be in order to recover from COVID if you get it, or to fight it off the way that it needs to be fought off. So physical health and mental health are always intertwined. If you are not emotionally in a good place, then it's going to be harder to recover from any physical health issue.
We're joined by Dr. Melanie Schwartz, licensed clinical psychologist and the owner of Viewpoint Psychology and Wellness, joining us on the MegaCast. And Dr. Schwartz, recently, Viewpoint Psychology and Wellness entered a partnership locally with some of our first responders at the West Bloomfield Police Department, where it's been found that first responders, because of the high stress nature of their job in general, but especially given the increased stress during the pandemic, that their mental health has been significantly impacted, even really beyond that of the general public as well. And so in the West Bloomfield Police Department, they recently created what's called a peer-to-peer support group with the help of Viewpoint Psychology and Wellness. What is a peer-to-peer support group, and how can it help an organization like our police department or other first responders in dealing with some of the mental health strains of a crisis like this?
Well, honestly, the only people who are truly going to understand what first responders are going through are other first responders. So what West Bloomfield has done is they have brought me in to consult and train the peer support team. So that's several police officers, dispatchers, whoever they have identified as people who would be appropriate peer support team members, who then other officers, other people at the department, dispatchers, whoever needs the assistance can go to those peer support team members to talk to them about whatever they need to talk about, because again, they're the only ones who know truly what anyone in the department is going through, because they're all going through it together. So that's what happens. And then if they determine that they cannot assist for whatever reason, then they reach out to me, and then I intervene in the way that I need to help them with whatever mental health issue that they're experiencing.
Yeah, and it seems to be that the culture in among our first responders, particularly our police officers in the past, and Deputy Chief Kurt Lawson from West Bloomfield Police Department even said this verbatim, that as far as he could remember, the mantra had always been, in terms of mental health struggles in the police department, that you suck it up and you move on. Yeah. How does a program like this help to aid in preventing that sort of mantra from being the way that our officers think, knowing that they have those support systems in place?
Well, they're trying to break the stigma. We're working on it. We're working hard there, to really put it out there and educate the police department that they're not alone. They don't need to work through their issues alone, use unhealthy coping skills, whatever it might be, that if you are in this field of work, that there's going to be some mental health issues, most likely because of the nature of the work and what they're seeing and the trauma they're watching play out. And that they're going to need some help to process that information and kind of know what to do with it in a healthy way. So there's a lot of education. There's a lot of putting it out there that the peer support team is available, so that people can go, the department can go and talk to these people, or, that I'm available as well if that's what they need to talk to. But it's really about educating and just breaking the stigma that the department does need some help with mental health issues, because no one's free from it. It's everywhere and all over the world, and the department doesn't have to do it alone.
So this isn't a unique program to the West Bloomfield Police Department. There are other police departments as well that have began to implement programs like this across our local area, across the U.S. as well. So with that being the case, and with the old mantra of suck it up and move on being what it is, where did that change occur? What has changed in our police department paradigm across the board that has led so many of them to implement these kinds of programs?
I think, well, number one, I think mental health is changing. How people feel about mental health is changing. People are more open to it, whereas before it was a very hush hush, don't talk about it, don't deal with it. Again, the country is trying to break the stigma of it, that it is, as common as the common cold or the flu or cancer or health issues or, heart issues. And it's something that needs to be dealt with if you're experiencing it and what that looks like. So it's really about breaking it down and educating, and I think also the younger generation of police officers have a slightly different mentality, because their generation is a bit more open to mental health than some of the older generations. At least that's, what I have been told from the ones that the department and who I've interacted with, that it is more tolerated and people are more open to it. So the new generation of officers that are coming in, and dispatchers and so on and so forth, are more open to getting help and receiving help.
I'm joined by Dr. Melanie Schwartz from Viewpoint Psychology and Wellness, also the sponsor from Viewpoint Psychology and Wellness for the new West Bloomfield Police Department peer-to-peer support program and their mental health support efforts. And so how does this program work within the police department? Because on one hand, you want to be able to make sure that these officers and these other employees of the police department are able to get these services properly and be able to have their concerns or their issues addressed. But on the other side, you also don't want to have, as we work to break that stigma, to create a stigma within there around these individuals who may be seeking these services. So how do these programs work to help support these individuals, but also protect them as well?
Well, it is completely confidential. So if a member of the department were to go to one of the peer support team members, it is 100% confidential. The only other person within the department that would know would be me, if that's something that they needed to consult with me on. And confidentiality is key, and that everybody knows that it's confidential. Now, even though everyone's going through very similar experiences there, obviously they don't want to be the one person who where they think people know what's going on. So that is key, is making it very clear that everything that they say is very confidential. The only time that confidentiality is broken is if there's a risk of harm in some way, if there's some fear that they're going to hurt themselves or someone else, then at that point, then we break confidentiality. But beyond that, whatever is said to the peer support team or to me stays where it's at.
So you mentioned the peer support team. There are people within the department that will be trained to be part of that peer support team to provide these services to their colleagues. What sort of training do they go through in order to provide effective consultation and guidance and counseling to their colleagues in the department, in partnership with you and your team over at Viewpoint Psychology and Wellness?
There was significant training. They went through a 2-week training with me, and then they also went through critical incident management training, and to provide debriefings and critical incident interventions if needed, for for some type of traumatic event that were to occur. So, and then there's ongoing interventions and check-ins with me as well. And we're only not even a year in, but there will be additional trainings as well.
We're joined by Dr. Melanie Schwartz from Viewpoint Psychology and Wellness, joining us on the MegaCast as we talk about the West Bloomfield Police Department implementing a new peer-to-peer support program to help officers and other employees of the department work with professionals as well as their colleagues to help them through their mental health and addressing any concerns that they may have or traumas that they may occur on the job or outside to help them provide better services to our community. And Melanie, from a results standpoint, obviously it's very early on in this peer-to-peer program's infancy here in West Bloomfield, but in other places where these sorts of programs have been put into place, what has been the result there in terms of the morale of their police departments or the first responder departments, the mental health of the individuals that are working in those groups, and then, of course, the service to those communities as a result of those benefits?
Well, because more and more peer support programs are being developed, obviously it's been effective in other states, in other areas in Michigan. Even internationally, I know that there's peer support programs. I think what it comes down to is early intervention within the department is helpful, and educating them on what health, mental health, physical health looks like. And if you have a more mentally, physically healthy first responder, then number one, job quality is going to improve. They're going to be able to do their jobs more effectively. They're going to feel better. They're going to be able to help others with mental health issues more effectively. That's something that I know that they've somewhat been taught, but even through bringing in the peer support program, it's also they're being educated in that area as well. So I think it's teaching them to be more physically healthy, more emotionally healthy, giving them the right coping strategies so that they can perform in a more effective way and also improve their quality of life themselves.
Dr. Melanie Schwartz joins us from Viewpoint Psychology and Wellness on the MegaCast. So we talk about the impact of mental health on all areas of our lives during this pandemic and afterward as well. And what we've seen over the last couple of years really is we've seen, particularly in the realm of professional sports, more athletes being open about their mental health. In the past several years, from my recollection, it began a few years back with Kevin Love of the Cleveland Cavaliers in the NBA, and then more recently with Naomi Osaka, a professional tennis player who bowed out of a tournament for mental health reasons, and then very famously over the summer, prolific U.S. gymnast Simone Biles forwent a particular competition at the Olympics in Tokyo due to mental health, and even more recently, Philadelphia 76ers guard forward Ben Simmons taking a break because he says he is not mentally ready to get back on the basketball court. How important is it, as we try to break this stigma, how important is it for high-profile athletes and other people that are in the limelight in other areas of life to be open and honest about their struggles with their mental health? How does that help other people ultimately to develop the courage and develop the ability to then be open about their mental health and address whatever issues they may be having?
Very important. Well, number one, we have the perception that people in the limelight have it together, their lives are perfect, life is great. And the reality is it's not. They're just people, and they have everyday problems, and they're struggling with whatever they're going through. And so I think being able to model for the rest of the world that they have problems that they need to deal with in a healthy way, it helps other people recognize that, okay, it's okay to work through your issues. It's okay to acknowledge that they have problems, that they have anxiety, they have depression, they have things that they need to work through, and normalize it is what it comes down to. It's just normalize mental health and recognize that it's not just you who has this issue. It's famous people, it's professional athletes, it's people in the limelight, it's people who have everyday, just our everyday normal average person, and that we all have to work through it. And another piece to it too is that there's a specialized part of psychology, sports psychology, that's been around for years, sports psychologists. And so people in professional athletes have been working with psychologists for years and years and years. So this is not new. It's just new that they are, in fact, most, if not all teams have their own psychologist or therapist. And so they've been working through mental health issues for years.
We're joined by Dr. Melanie Schwartz from Viewpoint Psychology and Wellness with us on the MegaCast. And Dr. Schwartz, on the day that we're filming this live interview, outside really gloomy. It's not sunny and warm like it's been unseasonably over the last few weeks here in Michigan, and certainly throughout the summer and the spring. We're at the point of the year where it looks like the seasons are changing. It's going to be a lot more cloudy. It's going to get colder. The winter's going to settle in. And with that always comes the concern of seasonal affective disorder, or SAD. As we're heading into those months of the year, what should people be doing individually to prepare themselves for those natural changes that can occur with the change of weather, to avoid some of the pitfalls that may come mentally from that change of environment around them?
Well, it's definitely starting to happen. I'm starting to see it in my practice. When we had maybe a couple weeks ago when the weather slightly started to change, or we have some of those gloomy days, you definitely saw a change in moods. And Michigan is definitely one of those places where seasonal affective issues are very common. So what it's really important is to, what we'd like to do, obviously, when it starts to get this way, is start to hibernate. We just want to stay inside. We want to stay under the covers, stay in bed, not do the things that we normally do. And that is probably one of the worst things that we can do. What you want to do is you want to keep your structure. You want to keep your schedule. You want to make sure that you're engaged in healthy activities like exercise, and making sure you're continuing to eat healthy, and make sure you're getting your sleep, not too much, not too little. And make sure that you are continuing to socialize and do the things. We have no control over the weather here. We know what it's like here in the winter. A little bit unpredictable, but we know winter's on its way. And so what's important is also to remind yourself that it's time limited. And if we really think about it, seasons are only 3 months long. So we really don't get too much in one specific season. And, we kind of look at it like, oh, winter, I know I do. Winter's coming. Oh, we're going to be stuck inside for the next however many months. And that's it's not a good feeling, but it's good to challenge yourself and remind yourself that it's time limited. Spring will be here before we know it. Summer will be here before we know it, and we'll be back in the sun. And then, the people who get to go on vacation, that helps too, if you get to, and you go someplace warm and you get some sun. But making sure that you are engaging in healthy activities and not just sitting at home, hibernating, stuck in your house.
Well, Dr. Schwartz, we appreciate it. Thanks for joining us, giving us some advice for our mental health as we head into the colder months and the cloudier months of the year, and also telling us about this really interesting program that you and your practice is involved in with our local first responders. Thanks for the time.
Thank you.